Hello, and thank you for joining us today. May is Mental Health Awareness Month. My name is Dana Lassenby, and I'm the CEO and Executive Director of Oakland Community Health Network. OCHN serves individuals with intellectual and developmental disabilities, mental health challenges, and substance use disorder. As a public mental health system and service provider, it is important that we recognize May as Mental Health Awareness Month. In the next few moments, we will be sharing with you stories of hope and messages that will inspire and empower and support advocacy. Together, we can make a difference.
Hello, my name is Cheryl, and I am a community advocate educator on CNS Healthcare's anti-stigma team and a certified peer support specialist. I am a mother to 2 adult boys, a sister to 3 siblings, and a daughter to 2 parents. Music is one of my passions. As a person who was deeply affected by trauma in the past, I have been living with anxiety and post-traumatic stress disorder, or PTSD. I am currently in recovery because I reached out for help. I want to do my part to end stigma so that no one has to be afraid to reach out for help. Imagine living in a kinder community where everyone feels comfortable in their acceptance. The best compliment I received was in my peer support specialist job when someone told me they wanted to change their life because I shared my story with them. I'm asking you to please join Oakland County Health Network in doing what you can to begin ending stigma today. Let's talk about it.
My name is Michael, and I want to talk about my mental health hero. Her name is Laura. I watch her do, laundry. I watch her go out and take care of her business. I watch her take care of so much. But anyway, when I first met her, she kind of lifted me up, picked me up, and showed me just dust the dirt off, and hey, I can move forward. She showed me what I couldn't do, what I can do. And to me, that's my hero.
Hello to everyone taking part in Michigan Unites for Mental Health Awareness. And thanks to the Oakland Community Health Network for organizing this important event. As you know, May is Mental Health Awareness Month, and it comes at a really, really important time. Before the pandemic, about 1 in 5 people were affected by mental illness, and that number has dramatically grown. If you've been struggling with anxiety or depression, you are not alone. Meanwhile, deadly drug overdoses have soared during the pandemic. And only about 12% of Americans with substance use disorders receive specialized treatment in any given year. And that's just not good enough. We can change that. We can change those statistics by fighting the stigma that gets in the way of people getting the help they need, and by making it easier for people to access treatment, something I've been leading on, as you know, in the United States Senate. I've been able to secure more than $112 million in funding for 24 new certified community behavioral health clinics across our state in the last year. And Michigan is included in a nationwide initiative that I created to fund behavioral health the same as physical health. That is the difference, not with grants, but with permanent funding. Getting treatment makes a huge difference. I know this personally because my dad was bipolar. Actually, he was bipolar before people even knew what that term was. And getting the right treatment not only changed his life, but the life of our whole family. It's time we treat healthcare above the neck the same as healthcare below the neck. So, thanks for being here today.
Hi, my name's Angela Spino-Bagoda. I work at one of Oakland Community Health Network's providers, the Alliance of Coalitions for Healthy Communities, in prevention and recovery support, as a peer mentor and certified prevention specialist. As a person in recovery from a substance use disorder, I want to do my part to end stigma so others will reach out for the support and begin leading a life they want and deserve. Stigma changes the way that other people view an individual that is working to overcome a life-threatening disorder. What many people don't realize is that an individual and families will suffer in silence due to fear of judgment. Stigma impacts the way an individual views themselves and may even impact their decision to seek life-saving treatment. Stigma cheats an individual of housing, employment, and social opportunities. My recovery has given me the ability to be the very best version of myself. I work hard at learning new coping skills. I take care of myself and have learned new skills to help me be a good wife, mother, sister, and daughter. I've become a very hardworking employee. I am grateful to the Alliance for giving me an opportunity to thrive within their organization. I have the opportunity to help other people learn how to sustain and make steps towards long-term recovery every day. I want to work together as a community to reduce stigma so that individuals don't neglect to seek treatment for fear of judgment. So an individual seeking treatment has the same opportunity to build a life in recovery that I did. Let's work together towards understanding and supporting one another. Please join me and Oakland Community Health Network in doing what we can to begin ending stigma today.
Hi, my name is Stephanie Laird, and I want to share with you today some of my life experiences. I've been living on my own independently for 6 years now in an apartment. I pretty much do everything myself. My daily living stuff, cleaning, cooking, and taking care of my bills. And I also, when I need to, I'm able to make my own doctor's appointment. My independence is very important to me, and I really feel that I am living my best life. I have a job as a peer mentor at Community Living Services, Oakland County, and I've been a peer mentor there for about 8 or 9 years now, and I really love my job.
Hello, my name is Desiree, and I'm a consumer at Moreau CMHA. I attend Crossroads Clubhouse, which helps me greatly. I learned skills on the computer, socialize with other members, and I just have fun. Then my case manager is wonderful. She listens to me and helps me when I need it. I'm also in this DBT group where we learn skills, and that would help me with my mental health. Without Monroe CMHA, I probably wouldn't get the help that I need.
I'd like to say that anyone can be stigmatized. It doesn't matter what the situation is, but you have to think of what the other person feels like.
I have trust in my relationships. The quality of my relationships with family, loved ones, and friends is much improved. And it's nice to be relied upon with work requests, being there for folks who need me, and including faith in God into my daily life. So please join me in the OCHN in our initiative to begin ending stigma today and become a best star.
Hi, I'm Vicki Landsman Peterson. I work at Community Housing Network in the Housing Resource Center. I'm a passionate advocate for people who cannot speak for themselves. I also enjoy gardening, swimming, and believe laughter is the best medicine. I have disabilities, and just like everyone, I want to feel included. Being part of the group feels good. Stigma behaviors are unacceptable behaviors. We all want to live our lives on our own terms. Please join me and Oakland Community Health Network in our goal to begin ending stigma today by using empathy and compassion. Ending stigma is vital to everyone throughout our communities and the public. Thank you.
Many people with a mental illness don't feel comfortable and are ashamed about getting treatment. Mental illness can be treated just like any other disease, so don't let stigma hinder you from getting the help and support that you need. We can begin ending stigma today by treating people with a disability with dignity and respect. People with mental health, substance use problems, or who has a developmental disability make valuable contributions to society. So let us recognize and focus on the positive contributions made by them and not the negative. By ending stigma today, we'll make this world a better place to live in. Thank you for listening.
Hi, I'm Frank Bublitz, owner of Fame LLC in Port Huron. I was once a consumer of mental health services. Now I'm a mental health peer specialist. I provide creative arts services to people with mental illness, including peer specialists. I want to tell you that when you put your mind to recovery, don't let the obstacles get in your way. and you can have as full a life as you work hard to achieve. Stay united, Michigan, for mental health.
Did you know that May is Mental Health Month? The month is commemorated to raise awareness and defeat the stigma associated with mental illness. This year, in the context of COVID-19 and all the changes we have had to face, many people are feeling the weight of the pandemic. Surveys have shown that almost 40% of Michiganders have symptoms of depression and/or anxiety. And there's no shame in getting help if you're feeling down or stressed to the point that it's difficult to function. Mental illnesses are real illnesses that can get better with treatment. Suffering with mental illness can take its toll on our physical health and can even impact our families and friends who may want to help but don't know how. Some people may even be having serious suicidal thoughts, but may be reluctant to get help or to talk to others about them. All too often, people are embarrassed or ashamed for experiencing symptoms of mental illness, or they just don't want to burden people. But this is stigma at work. Mental illnesses should be treated like physical illnesses, where calling your doctor or therapist is just what you do, just like getting treated for heart disease or diabetes. If you or someone you love needs support and help, call 211 for local resources near you. Or if you just want someone to talk to, call the Stay Well counseling line. Your mental health matters. Pay attention to it, and don't be afraid to get help. And thank you for listening.
Hi, I'm Kevin Fisher, Executive Director for NAMI Michigan, the National Alliance on Mental Illness. And as we all know, May is National Mental Health Awareness Month, which is our opportunity to increase awareness and education about mental illness, what opportunities there are to prevent mental health crises, and what resources are available to us. Here at NAMI, we believe that stigma is the leading barrier that prevents the early diagnosis and treatment that leads to better outcomes. Ultimately, that means we can improve the quality of life for the hundreds of thousands of Michiganders and the millions of Americans affected by mental illness. And we can do this here in Michigan. As long as we understand that mental illness is a medical diagnosis, not a weakness of character, and that we need to address mental illness as equally important as our own physical health. In Michigan, we are fortunate to have high quality behavioral health care available to us through our public behavioral health system and the extensive system of providers in our network. So what can you do? Join us. Join our mental health movement. Let's normalize the conversation about mental illness. Let's encourage our friends and family who may need behavioral health care help to seek that help. Let's not judge. Let's support. Let's change and eliminate, ultimately, the stigma associated with mental illness. Thank you.
My name is Pam Casper. I receive public mental health services in Oakland County. I've had 16 psychiatric hospitalizations. I haven't had any psychiatric hospitalizations in more than a decade because of the services and supports that I receive through the public behavioral health system. Previously, I had private insurance. Unfortunately, the traditional mental health services that I received through my insurance were not adequate to help me. I oppose the Senate's gearing towards integration proposal. Instead of creating specially integrated plans, integration should be improved at the point of service delivery. Integration already occurs in various ways, such as behavioral health homes, co-location of primary care and behavioral health services, and certified community behavioral health clinics. Michigan is a certified community behavioral health clinic demonstration state. Certified community behavioral health clinics provide a comprehensive range of evidence-based behavioral health services. They coordinate care with physical health care providers, social service agencies, law enforcement, etc. The state should learn from the demonstration instead of implementing specialty integrated plans. Please keep the public mental health system public.
My name is Shama Fahim, and I'm an adult and pediatric psychiatrist. I'm the Chief Medical Officer at Detroit Wayne Integrated Health Network. Our day-to-day stress and the additional pandemic has taken a toll on everyone, and I want to remind everyone that it is imperative that you take care of yourself and take time out for yourself. Your physical and mental well-being is extremely important because it really determines how we act, how we feel, and how we think. It also determines how we handle stress and make healthy choices. So there is always room for improvement, and we all should strive for it. But I have been extremely touched by success stories shared by people where they have received help, treatment, and incredible support through community mental health system and how it transformed their lives. So in my opinion, that's where the system belongs, in the public space. Stay well, and thank you.
Hi, my name is Cheryl Myers. I work for Oakland Community Health Network on the training team. My job is general clerical. May is Mental Health Month, and mental health is a very important topic and close to my heart. I will be talking about deaf and hard of hearing, mental health, and my recovery story. Currently, there are about 11 million deaf and hard of hearing people in America. 90% of deaf and hard of hearing people are born to hearing parents. Lack of communication with family members is a big factor in developing mental health issues among deaf and hard of hearing individuals. The majority of hearing parents do not take time to learn ASL to communicate with their deaf and hard hearing children because they themselves have never been exposed to anyone who is deaf or hard of hearing, so they are unsure how to communicate with them. Doctors' approach to hearing loss is to try to fix the hearing rather than preserving the deaf culture. What I mean by that is that doctors prefer hearing aids, cochlear implants, oral methods, over using sign language to teach deaf and hard of hearing children. Doctors do not provide parents enough options to explore when navigating their way through the system to find the best communication approach for their children. It has been reported that about 40% of deaf and hard of hearing people suffer from mental health issues in America. There is a lack of mental health professionals who are experienced in treating deaf and hard of hearing people, and this issue needs to be addressed. I will explain my background and my recovery story. I was born deaf, and I also have cerebral palsy and bipolar disorder. I use a wheelchair and use ASL, American Sign Language, to communicate. I'm the only deaf person in my family. When I was born, doctors told my mother not to teach me sign language, and they fitted me with hearing aids. They focused on the oral approach. My family never learned sign language. I learned sign language at school with other deaf and hard of hearing children. Living with disabilities in a hearing family and communication barriers contributed to me developing bipolar disorder. I was diagnosed with bipolar disorder when I was in college in my 20s. It was a struggle to find the right therapist who understood ASL and my disabilities and how that affected my identity, who I am, and where I belong in society. We need to focus on providing better mental health services to deaf and hard of hearing people. The first step is to get more mental health professionals educated on deaf culture and how that affects our lives. Recovery is possible with the right support system. I have added some information regarding deaf and hard of hearing and mental health topics. Thank you.
I was born by the river in a little tent. Then I go to my brother. I say, brother, help me, please. It's been too hard living, but I'm afraid to die. It's been a long time coming, but I know a change gonna come. Oh, yes, it will. My name is Malkia Newman. I am a person with lived experience with bipolar disorder, 20 years in recovery. I sing for my supper as the team supervisor of CNS Healthcare's anti-stigma program, and I'm here to declare a change is here. Stigma has been named as one of the main deterrents for why people won't step forward to get the help that they need. Having lived most of my adult life with an undiagnosed bipolar disorder, I don't want to see anyone have to go through years and years of suffering like I did when I know that help is available and it's effective and it works. Mirror best behavior for those that you have influence with, because we know that we can change the world.